Hello everyone. This presentation is on Tang, also called tangerine peel and bamboo shavings decoction. It appears on the California Acupuncture Board Examination Herbal Formula list. I will review its traditional pattern, a short hypothetical patient case, 3 potential drug-herb interactions, and a practical management plan. The purpose is educational. Herbal formulas are selected by pattern, but medication safety still requires attention to pharmacology, dose, duration, and the individual patient. Traditionally, Tang is classified under regulate the Chi. A representative pattern is stomach deficiency with heat and rebellious Chi causing nausea, retching or hiccup. Important ingredients include Chen Pai, Juru, Ren Shen, Gan Kao, Shen Jiang, Da Zhao. The key clinical idea is pattern matching. A formula can be appropriate for one patient and inappropriate for another patient with the same biomedical diagnosis. Before treatment, I would also screen for red flags, confirm that urgent biomedical evaluation is not being delayed, and review the exact medication and supplement list. My hypothetical patient is 49-year-old man with chronic nausea, diabetes and hypertension. The current medicines are metformin, hydrochlorothiazide, warfarin. This case gives a plausible reason to consider Tang, but it also creates interaction questions. I would document the tongue and pulse findings that support the pattern, confirm the diagnosis, and ask about allergies, pregnancy status when relevant, kidney and liver disease, bleeding history, and use of over-the-counter products. Medication reconciliation is essential because many interaction risks come from the combined physiologic effect rather than from one single herb. Interaction 1 is Gan Kao plus hydrochlorothiazide. The mechanism is licorice can lower potassium and raise blood pressure. The clinical significance is moderate with prolonged use or vomiting. My management plan is monitor electrolytes and blood pressure. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. Interaction 2 is Ren Shen plus metformin. The mechanism is ginseng may lower glucose. The clinical significance is moderate when oral intake is reduced. My management plan is monitor glucose during nausea episodes. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. Interaction 3 is Ren Shen / Shen Jiang plus warfarin. The mechanism is ginseng can alter warfarin response, and ginger may add mild antiplatelet activity. The clinical significance is potentially moderate. My management plan is monitor INR and bleeding when starting or stopping the formula. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. In conclusion, Tang may be reasonable when the patient's presentation matches stomach deficiency with heat and rebellious Chi causing nausea, retching or hiccup. The main safety principle is not simply to label herbs as safe or unsafe. Risk depends on the specific herb, preparation, dose, treatment duration, the patient's organ function, and the drugs being taken. I would use a reputable product, start conservatively, monitor the most relevant objective values, and communicate with the patient's physician and pharmacist. This presentation is for education and does not replace individualized medical care. Key references include the California Acupuncture Board Examination Formula list, standard Chinese herbal formula texts, such as Bensky and colleagues, Chen and Chen's Pharmacology and Applications text, and evidence-based drug and herb interaction resources. Thank you.